The reason we put this leg right up on top is we want to put people in a nice neutral lumbar spine position, right? If I just let that leg hang down to the ground, he's going to be in lumbar rotation. Not really what we want, because we're trying to mobilize thoracic spine, we're trying to mobilize that glenohumeral joint and drive some good scapular motion as well. So what we'll do is we'll kind of just have him lay right back here. I'll tell you guys, usually just look right up towards the ceiling as you do this. Palm right up to the wall, the sky. Hand right up here. So this is the sideline extension rotation. This is the middle one in our little progression. What we're going to do here is we're just going to drive some internal rotation, thumb down, pronation with internal rotation. As we come back up, we're going to roll right back. As he does this, we're using humeral motion to drive scapular motion, so posterior tilt and retraction, which is going to drive a little bit of thoracic spine range of motion. So not everybody's going to be able to put their hand on the ground or anything like that. So all it is, right down here, roll right back to there, and he could lay back again. See how his head's kind of coming forward? I'll tell guys, just relax your head. Thumb right down, roll back, you feel a good stretch across the pecs. Nice gentle way to get a little bit more external rotation, because the key is he's getting a little stretch across here. That scap is posterior tilting as he goes. Okay, so it's mobilizing that T-spine, and he's rolling right back. Okay, so we're not forcing any range that isn't there. He's not tweaking his lower back in the process. So that's the first one. All right, does that make sense to everybody? Stay right there, stay right there. From there, we'll actually just transition right to another drill. This one is good for some of the same reasons, but I like it a little bit better for those guys who have been on their back and not been able to get that shoulder flexion back. What we'll do is we'll go thumb down to back pocket, and then we'll roll right up overhead just to there. Okay, so we'll get a good stretch right across here. We're getting a little bit of pec minor. We're rolling them back into that little bit of external rotation to get overhead, and then right back here. What you'll see in people with big restrictions is it's not uncommon to see one of two things. Okay, the first one is as they come to the top, they're just going to be like an elbow bend. So they're going to try to get their hand to the floor because they know that's what they're supposed to do, but it's not going to come from the right place. The bigger one is if they're down here, they'll roll and they'll come right out in front because they lack that flexion. So again, as they come up overhead, posteriorly tilt that scapula, drive that nipple to the ceiling and scap down towards the hip, and really just try to get a good stretch right across the inferior aspect of the joint and right across the pec as they get up overhead. Okay? Questions on those? One little thing we've added in a little bit differently is just to kind of kick this up a notch and give it a little bit more challenge is we might have them do these drills and give them some of those rhythmic stabilizations as they get to those positions. So just those subtle little dynamic stabilizations can kind of make things a little bit more challenging. So he's almost got to pull himself back into that position in spite of the fact that I'm giving him that. So I'm not beating him up pretty bad, and Mike's going to talk about this a lot in the other lecture in just about a half hour here. But the last one we will do from this exact same position is I might have guys pull back against me. I'll just give them a gentle force where they have to actually consciously pull themselves into that posterior tilt. It's almost like trying to pull yourself back to throw. So you activate all that posterior shoulder muscles, pop that chest up to the sky, and just resist against my hand. So he might come back, push against me. It's just a gentle movement. You want to make sure they're not just going crazy at their wrist. They should pull all through the shoulder and not hike the shoulder. Okay? So we got all kinds of good ones we can do from this position to kind of get that external rotation without just plopping somebody down on a table and kind of just rolling back there. All right?